today's session. So here in this session, we're going to discuss or we're going to continue the discussion of anti-anginal drug. So in the previous session, we have already learned regarding the basic concept of anti-anginal drug. We have seen these are the cardiovascular drug which will be generally used to manage certain conditions associated with cardiovascular system. Generally, we are going to see these drugs will be used in case of the management of angina pectoris or the disease condition of coronary artery disease. We have also learned about the 5 classification of anti-anginal drug, which includes the nitrates, calcium channel blocker, beta adrenergic antagonist, potassium channel opener, and a group of drug which is called known as miscellaneous group, right? So there are many other drugs which are used in case of management of the angina. So we have also discussed in detail regarding the nitrates and calcium channel blocker. Now, in nitrates and calcium channel blocker, we have seen nitrates generally will be reducing the preload of the heart, and whereas we have seen also this particular group of drug will be redistributing the coronary circulation or the coronary flow. That's how it is going to manage the ischemic zone, and it is going to reduce the symptoms associated with angina. Whereas we have seen in case of calcium channel blocker, generally these are the drugs which will be blocking the calcium channel, as the name itself is suggesting. Now, as we know, the calciums are a very important part of muscles which maintains its contractility, mainly for the cardiac muscles and for the smooth muscles. Here we are going to see this particular group of drug of calcium channel blocker is blocking the calcium inflow via the calcium channels into the muscle. That is the reason why it is reducing the contractility of the cardiac muscles, as well as it will reducing the constriction ability of the smooth muscles which are associated with heart and blood vessels. That's how ultimately it is reducing the peripheral resistance by which the blood pressure will be getting reduced, as well as it will be reducing the cardiac workload. So we have discussed regarding the indication, contraindication and adverse effect of both of the classification of drug. Now here in the beta adrenergic antagonist, we are going to read in this session. So this is the third classification of anti-anginal group of drug. Beta adrenergic antagonist. So as the name itself is suggesting, it is antagonist or it is acting as an antagonist. So basically we can say the beta adrenergic receptor will be affected by this particular group of drug. How it is affecting, let us study now. So this particular group of drug, which is known as beta adrenergic antagonist, basically blocks the action of catecholamines, which is mediated through the beta receptor cells of the heart muscles. Like what happened is this beta blockers will be very effective in decreasing the frequency and severity of the heart attack. So as we know, the heart attack, which is basically caused by myocardial infarction or decreased functional ability of the heart muscle layer, what generally happens is this particular drug of beta blockers will be reducing the frequency and the severity of the attacks, whereas it also increase the exercise tolerance even if the person is present with angina. Basically what it does is it decreases the catecholamine activity. That's how it decreases the heart rate, blood pressure, contractility of the myocardium. That is the reason it is resulting in decreased myocardial oxygen requirements. So I'll repeat once again, this particular group of drug we are going to see as it is known as beta blockers, will decrease the frequency and severity of the heart attack, or we can say it will be decreasing the chances of the development of heart attack. Whereas it also increase the exercise tolerance even if a client is present with angina. The reason behind it is this particular group of drug of beta blockers definitely decrease the heart rate, the blood pressure, as well as the contractility of the heart muscle, which results in decreased myocardial oxygen requirement. That is the reason why a person, even if they have having the symptoms like angina, they will be exercise tolerance, or their exercise intolerance will be reduced by using this particular group of drug. Now we are going to learn regarding different types of beta adrenergic antagonist. Basically, we are going to see beta adrenergic antagonist can be classified under four types. The first one is known as the non-selective type beta adrenergic antagonist. The example of this particular group of drug includes the propranolol, whereas the second is known as the cardiac or cardio selective beta adrenergic antagonist. The example of this particular group is atenolol, whereas the third is the partial agonist, which is known as the pindolol. The fourth is additional alpha blocking agent, which is termed as labetalol. So I hope now you understood that these are the four different types of beta adrenergic antagonists which are used in the management of angina and coronary artery disease. Now we are going to learn about the exact mechanism of action, how this beta adrenergic antagonist is going to affect. So this particular drug blocks the adrenergic receptor of the sympathetic nervous system. Basically, it will be also affecting the heart and kidneys. What will happen by decreasing or affecting that particular beta adrenergic receptor is it will be decreasing the cardiac workload, and also the oxygen consumption or the requirements of the oxygen by the myocardium layer of the heart here will be decreased. It also will be decreasing the renin secretion from the kidney. That is how it is going to lower the blood pressure. So initially, this beta adrenergic antagonist will be affecting the beta adrenergic receptor, where we are going to see the renin secretion will be depleted, the cardiac workload will be depleted, as well as the output or cardiac output also will be getting decreased, and the oxygen requirement will not be increasing. Lowering the blood pressure is also an effect of beta adrenergic antagonist. Now, through this particular group of drug will be reducing ultimately the cardiac workload and increased blood pressure. So, in case where a person is present with coronary artery disease, or in case where a person is present with myocardial infarction and angina, definitely this is the drug which is having a very effective treatment to manage the condition of angina specifically. Now, we're going to read the exact indications which are considered the cases where we should definitely administer the beta adrenergic antagonist. The first indication being angina pectoris due to atherosclerosis. So often with atherosclerosis, we're going to see as it will be interrupting the blood flow into the myocardium, so does the myocardium cells is going to go for necrosis formation, and that is the reason why a person will be suffering from squeezing chest pain, which is termed as angina. Now, severe or moderate to severe angina or the condition of angina pectoris will often manage with beta adrenergic antagonist. In case of hypertension also, it is a very effective drug which is known as beta blocker, will definitely helps to lower the blood pressure. The next condition being the myocardial infarction. So here, the myocardial infarction definitely will be managed with this particular drug. Even this particular group of drug will be used in migraine prevention and ventricular and supraventricular arrhythmias, even alcohol withdrawal syndrome. In this case also, beta adrenergic blockers will be sometimes used. So as we have learned about the indications, now we should definitely discuss about the contraindications of this particular group of drug. So the first contraindication being the sinus bradycardia. Third degree heart block is an exact contraindication for administration of beta adrenergic antagonist. Cardiogenic shock and congestive heart failure is the second type of conditions which are contraindicated for the administration of beta adrenergic antagonist. COPD and bronchial asthma is also considered to be contraindication for the administration of beta adrenergic antagonist. In case of pregnancy, beta adrenergic antagonist should not be used or administered. Peripheral and cerebrovascular disease also considered to be contraindication for the administration of beta adrenergic antagonist. Renal failure being one of the most important contraindication, whereas diabetes, thyrotoxicosis, lactation, and respiratory disease, basically the chronic respiratory disease, are considered as contraindication for administration of this particular drug. Now we are going to learn about the side effect of this particular group of drug, which includes fatigue, gastric pain, constipation, and diarrhea being very common side effects of beta adrenergic antagonist. Sinoatrial or atrioventricular nodal block can also occur. Tachycardia and sleep disturbances also are very common side effects of this particular drug. Now you have to remember, although the development of the side effects are not so severe or very common, that is the reason the beta adrenergic blockers or beta blockers are very commonly used drug to treat hypertension as well as coronary artery disease or cardiovascular disease which cause the angina development. So I hope you understood the concept of beta adrenergic blockers. Now we have already done with three major important classification of anti-anginal drug, which definitely include the nitrate first. So we have discussed how the nitrate works. So we have seen it reduces the preload of the heart as well as it helps to redistribution of the blood flow through the coronary circulation, by which it will be managing the ischemia and will be preventing the progression of it as well as will manage the symptoms of angina. The second, we have seen the calcium channel blocker, which definitely we have seen it will be reducing or blocking the calcium channel within the cardiac muscle and smooth muscle. Now generally, because of calcium channel blocker, it will be dilating the blood vessels as well as it will be reducing the cardiac contractility. Thus, it will be reducing the oxygen requirement and demand of the cardiac muscle cells, as well as dilation of the blood vessels will cause decreased blood pressure as well as increased blood supply to the coronary area where the ischemic zone are present. The third is beta adrenergic antagonist, where we have seen the beta adrenergic receptors here will be blocked by this particular medication. That's the reason why here the renin secretion from the kidney will be reduced, as well as the heart here, the beta adrenergic receptor are going to blocked by this drug. That is the reason why here also the heart rate will be reduced, as well as the contractility or the strength of the contractility of the heart muscles will be reduced, as well as the oxygen demand of the myocardial cells will be reducing, and also it will be lowering the blood pressure. That's how this three classification of drug will definitely helps to reduce the oxygen demand, reduce the heart rate and the contraction of the heart muscle cells, and will be dilating the blood vessels so that it will be improving the blood circulation, but it will be reducing the blood pressure within the vessels. That's how it will be working to manage the condition associated with coronary artery disease and angina pectoris. Now we are going to read about the fourth classification of anti-anginal drug, that includes the potassium channel openers. So as the name itself is suggesting, potassium channel openers. So in case of calcium channel block, we have seen here the calcium channel are getting blocked because of the synthetic drugs. Here, this drug of potassium channel opener will be causing opening of the potassium channel which are present into the muscle cells. Now, potassium channel will be getting activated because of adenosine triphosphate, and where the potassium will be getting into the smooth muscle. Now, the most prominent action is the hyperpolarization and relaxation of the vascular wall, as well as the visceral smooth muscle. So that is the main activity of the potassium channel or the potassium influx. It will be relaxing the smooth muscle into the visceral parts as well as into the blood vessels. Now, potassium channel agonist, which decrease the concentration of calcium ion within the cell and increase the potassium ion within the cell. So what basically it does is it affects the potassium channel. As it is opening, the potassium channel in the potassium will be influxed into the cells, whereas the calcium will be getting outside of the cells. And because of decreased amount of calcium which is available within the muscle, that's the reason the excitability in the smooth muscle cells here will be reduced. That's how it is going to relax the blood vessels as well as the cardiac muscles. The example of the drug which comes under the potassium channel opener includes the pinacidil. So this is the most commonly used drug to manage or to lower the blood pressure as well as to reduce the cardiac workload by influxing the potassium through the potassium channel into the cardiac cells as well as the smooth muscle cells, where the calcium will be decreased here. That's the reason the excitability will be reduced and cardiac muscle cells and blood smooth muscles or blood vessels associated smooth muscle will be relaxed. Now we are going to learn about the miscellaneous drugs. What are the other, or in layman term, what are the other drugs which are used to manage angina pectoris or coronary artery disease? So the first drug in this classification includes trimetazidine. Trimetazidine is a very commonly used drug which is actually a piperazine derivative. This particular drug or agent optimizes the myocardial uptake of residual oxygen and substrate supply. Thus, basically ensures a long-term protection towards the myocardium against the harmful effect of ischemia. So I'll just repeat once again. You have to understand basic concept that as we have studied, ischemia is basically occurring when there is no proper blood supply to the myocardium layer of the heart. Here the blood circulation is decreased, right? That is the reason why the ischemia has been developed. When we are talking about the decrease in the blood flow, it does mean the oxygen and the nutrients supply here is not adequate enough. That's the reason the cardiac muscle will be going under harmful pathological changes. But this particular drug, what it does, it helps the myocardium to reuptake the residual oxygen which is present, as well as it will ensure the substrate supplement to the myocardial cells which has achieved with ischemia or which has attacked with ischemia. That's how it is going to continuously supply oxygen as well as substrate, so that the myocardial cells can maintain their functional and anatomical ability. That's how it will be reducing the harmful effect of ischemia. The second drug of this classification includes oxyfedrine. Now, oxyfedrine is nothing but a vasodilator which increase the myocardial oxygen supply and improve the myocardial oxygen demand ratio. I hope you understood that this particular drug, what it does is it improves the myocardial oxygen supply compared to myocardial oxygen demand. That's how it will be improving the condition or symptoms associated with angina. So the next drug in this group includes dipyridamole. So dipyridamole basically a very commonly used drug which is considered to be as a very powerful coronary dilator. When I am using the term of coronary dilator, it does mean this particular drug or agent will be directly affecting over the coronary arteries and it will be dilating those arteries which are present in the coronary circulation. So it increases the total coronary blood flow by preventing the uptake and degradation of adenosine, which is a local mediator, which generally involved into the autoregulation of coronary flow in response to ischemia. So I hope you understood the concept. Firstly, this particular agent will be increasing the coronary blood flow. The secondly, it will be preventing the destruction of the adenosine, which actually acts to autoregulation of the blood flow within the ischemic zone, where basically this particular adenosine will be ensuring that the ischemic zone of the myocardium are getting maximum amount of blood flow. So this drug will be preventing the destruction of adenosine, so that the adenosine will be continuously doing their functional abilities there. That is the reason why the myocardial ischemic zone will be getting enough blood flow to survive. That's how this particular drug will be affecting on the coronary blood flow and it will be reducing the signs and symptoms associated with ischemia. So I hope you completely understood now about the concept of this group of drug of anti-anginal drugs. We have seen 5 categories: nitrates, calcium channel blocker, beta adrenergic receptor, potassium channel opener, and some drugs which are considered to be miscellaneous drugs. Now, we have learned about it. So I hope you have enjoyed this topic and understood the concept. Thank you so much for attending this session. Stay tuned for the next session where we are going to continue the discussion of cardiovascular drugs.